Hello, so good afternoon, everyone. So thank you all for coming in our first hybrid event for this AfterLab tonight. Today, we are very pleased to welcome you at the French Embassy. Thank you all for coming here tonight. And we are also very pleased to welcome all participants online. We have many people tonight joining this AfterLab. Today, the topic will be with our expert, Caroline Sevoz-Couche. She will talk about slow deep breathing, how it works and what's for. So this AfterLab is a hybrid event. So if you have any question, please feel free to ask a question in the chat box. Or for people joining here, raise your hand and we will take the question at the end of the presentation. Please note that the presentation is recorded and feel free to ask a question. Just a reminder for people in the room, please keep your mask on and enjoy the presentation. So AfterLab is from French Lab. It's a joint initiative by Ambassade de France, CNRS, and French Chamber of Commerce. Thank you all, and I'll pass to you, Caroline. Thank you.
Okay, thank you. Thank you very much for being here, and thank you for this kind introduction. So I am Caroline Sevoz-Couche, and I'm a researcher in INSERM in France, in Paris. And I also work here in collaboration with NUS at the Department of Pharmacology. But there will be nothing to see with pharmacology tonight, just very normal and easy way to do modification in your body and your brain. So I'm very happy today to share with you some of the findings that have been found in the past 50 years on the control of breathing and body and mind. And I hope I will convince you at the end of this presentation that this has much more to do, much more than only relaxation. It has to do with a lot of body and brain functions as concentration, improvement of decision-making, improvement of inflammation, and so on. So I will first begin with a short introduction, showing you a link between breath control and body and mind. And in this introduction, I will mention an expression that is a coherent heart rhythm. So I will explain what is coherent heart rhythm and what does that mean. And you will see that it has to do with the stimulation of one particular nerve, the vagus nerve. And this has to do with stimulation of the descending vagus nerve from the brain to the heart, but also the ascending vagus nerve from the heart to the brain. And this is why it's very interesting. And then I will show you why it's important to have a coherent heart rhythm and a maximal vagus stimulation. And then we'll do a very short practice of deep breathing during 3 minutes all together here on site and you at home or at work. And then after these 3 minutes, you will be able to connect to a short poll. You will have 5 possibilities to answer. You can answer different choices, put some different choices about your feelings, what you really feel after this acute deep breathing. Acute because it's only a few minutes. And then we'll discuss that and we'll discuss what are the possibilities, the mechanisms that are in these effects. Okay, so first, it's known for centuries in the eastern part of the world that the breath will regulate and influence health and restore and improve health. It's been known for centuries, and even here you can see in Yoga Sutras of Patanjali, it was written nearly 2,000 years ago that a specific regulation of the breath will have an action on nerve perception with physiological modification followed by psychic effects. So it's very interesting to see that even nearly 2,000 years ago, they realized that breathing will control nerve functioning, and then you will have, because of that, physiological modifications on the body, but also on mind. And it's very also interesting to see that they added that the mind becomes prepared for acts of attention. So you see that they already knew that it's not only a way to relax. It's part of it is relaxation, but it has a lot of positive effects on the body and mind. And as I said, you will see that you have many more benefits in concentration and decision-making or pain perception. So this was 2000 years ago in eastern part of the world. This consideration came in the western part of the world very late in the 1800s. So you can see that it has taken a long time to go in the other parts of the world. And actually we had a popularity of this controlled breathing only in the middle of the 20th century because of the beginning of scientific studies. Scientific studies, you have proof that you indeed have positive effects, and it's not only some kind of vague feeling that you have after this technique. And it's only at the end of the 20th century that you have first scientific explanation on physiological mechanism underlying these positive effects. And this has to do with a coherent heart rhythm at a specific breathing frequency of 6 breaths per minute. So you have to remember that. It's you really have to breathe at a certain frequency, 6 breaths per minute, not below, not above, to have the maximal effect. Okay, so first, what is a coherent heart rhythm? So this is what you have with the spontaneous breathing. Usually it's between 12 and 18 breaths per minute. So what is a breath per minute? Breathing, a cycle breathing, it's an inspiration followed by expiration. And spontaneously you do that 12 to 18 cycles per minute. So you can see here the respiration, the flow respiration. And then associated with that, you have a very irregular heart rate. You see here the very small variation of heart rate, so the number of beats per minute. So you have a very small variation between around 5 beats per minute between cycles. And this is called low heart rate variability. Now, when you do deep breathing, 6 breaths per minute, this is what you get. You have a very smooth and regular respiration flow with inspiration and expiration. And at the same time, you have large amplitude oscillation of heart rate following this breathing rate. And this is what we call high heart rate variability. So this is what we want to have, this high heart rate variability with a maximal cardiac change between cycle of respiration. So what does that mean really? We have to come back on this drawing. I hope it's not too complicated, but you really have to understand what is going on in the link between breathing and heart rate modifications. From the brain, you have 2 components, 2 nerves going to the heart. One of them is the parasympathetic nerve, and it's mediated through the descending vagus nerve, and it slows down heart rate. That means that you have a decrease in the number of beats per minute if you activate this vagus nerve. On the other hand, you have a descending sympathetic nerve going to the heart, and this one is something to increase heart rates. So you have a balance between these 2 components, but during respiration, you modify this balance. And actually, during inspiration, respiratory neurons in the brain will act on the vagus nerve to block this nerve. So you don't have this slowing down component on the heart. You have only the one that speeds up. So this one wins, and then you have an increase in heart rate at the same time as you have inspiration. The contrary for expiration. During expiration, the respiratory neurons in the brain will stimulate the vagus nerve. So This one will win upon the sympathetic nerve activation. And then you have a slowing down on the heart. And then during expiration, you have a decrease in heart rate. Okay, so this is what you have during spontaneous breathing. Here it's not exactly spontaneous, it's a paced breathing, but at 18 breaths per minute. So it's close to the respiration rate you have during spontaneous breathing. So you see in blue, the respiration flow. I can show you here. And then you have in red heart oscillation. So during inspiration, you have increase in heart rate. Expiration, you have decrease in heart rate. But as you can see during the spontaneous breathing, you have a delay between the beginning of inspiration and the beginning of the increase in heart rate. And when you reduce the breathing rate to 15, 12, or 9, you can see that this delay actually is reduced. And we have a coherence only at 6 per minute. If it's 5, it doesn't work anymore. It's only at 6 per minute that you have a coherence. So what does that mean? The cardiac coherence is a synchronization with respiratory oscillation. And what's interesting is that you have, when you reduce breathing rate, you have an increase in the amplitude of oscillation, and this is a reflection of an increase of the vagus stimulation. And the maximal one is at 6 per minute. So you have increased heart rate variability. So now, this is one of our studies that is still unpublished, but you can see the cardiac changes. I will remove that. I am allowed to. I proceed. So you have here in red the heart rate variability, the oscillation with the different breathing rates. And you can see that, as you can see with this black box that represent the amplitude, you have the maximal amplitude of oscillation at 6 per minute. So it's at 6 per minute that you have the maximal vagus nerve stimulation. And then you can have positive effects at 6 per minute only with the maximal effects because of this maximal amplitude. Okay, so we have a maximal amplitude. We have what we call the maximal heart rate variability. Again, the heart rate variability is this amplitude of the difference between inspiration and expiration at 6 per minute, but breathing pattern matters. This is one of our recent studies here because if you breathe at 6 per minute, what does that mean? 6 per 60 seconds. So that means that one cycle is 10 seconds. One cycle is inspiration followed by expiration, sorry. So what you can have is an exact equal time between inspiration time and expiration time. This is the first case on your left. So this is an equal inspiration expiration time. You can also have a lower inspiration time compared to expiration in the middle. And in the right, you have an increased inspiratory time compared to expiration. For example, here, 5.5 seconds for inspiration, 4.5 only for expiration. And what we have found is that only an equal time for inspiration, expiration, or a lower time for inspiration compared to expiration, so that means an increased time, a superior time for expiration, will have the maximal effect on heart rate variability and will give the maximal positive effects. Okay, another thing also, of course, matters is the vagus nerve itself. Because you understand that if the vagus nerve is not functioning correctly, then you will not get a maximal heart rate variability and cardiac change compared to the one that has very good vagus nerve functions. So this is what we get, for example, here. This is in what we call controls. That means subjects without any disease. But you have younger and less young subjects. And you can see that above 40 years old, you have a maximal amplitude of something like 15 beats per minute. So this is the difference again between inspiration and expiration, the difference between the maximal heart rate and the minimal heart rate. So it's something like 15 beats per minute if you are above 40 years old. And if you are below that, you can see that your maximal stimulation can be to get a maximal cardiac change of close to 30 beats per minute. And you have also modification, of course, in disease where your vagus nerve is not functioning properly. So you can see here in red in patients with obstructive sleep apnea that the maximal cardiac change they get will be always lower than in control patients, independently of age. Okay, but what is important is, okay, we have an increased cardiac change or heart rate variability or vagal stimulation for younger people than older. But what is important is that compared to baseline, you still can increase this vagus nerve stimulation to get a higher cardiac change during spontaneous breathing. So it's important because you still can improve your vagus nerve functioning. And this is also the case in disease. Here is in diabetes. You see controls in green and diabetes patient in red. So the controls have a better cardiac changes because they have a better vagus nerve functioning than diabetes patients. But again, it's still improved compared to baseline. So that means that during the deep breathing, you still can increase and improve your vagus nerve stimulation to get positive effects, even if at the beginning you have a lower functioning of the vagus nerve. Okay. Now, why is it important to have this heart rate variability, this cardiac change? So everything that I told you before, I can see in the audience, this is because I want you to be very convinced that there are mechanical modifications, physiological modifications to go to the positive effects. So now we go to these effects. So why is it important? Because if you can see here, actually the vagus nerve, the descending vagus nerve, targets the heart, but not only, targets a lot of organs. And it targets, for example, tongue or esophagus or spleen. So it has an effect on inflammation. It also targets pancreas, so it has an effect on diabetes, and also in lung. So you can imagine that if you have a lower stimulation of the vagus nerve, then you will have deleterious effect on these organs. I will show you two examples here. If you have what we call parasympathetic withdrawal, that means that the vagus nerve is not functioning properly, so the sympathetic activity is the winner on the heart. Then, of course, okay, you have an increase in heart rate, but not only. You have also modification of the heart, and you have pericarditis, myocardial disease, and arrhythmia, because this balance is not good on the heart. And then that goes to cardiac dysfunction and heart failure. So it's very important to have the balance back. Another thing, if you don't have a good balance, you are more supposed to have a higher blood pressure. You can see here in the lower part on the right, you have high modification of cardiac changes during deep breathing. So that means that you have a good vagus nerve functioning and a good parasympathetic component. And then you have a lower arterial pressure. Compared to the one that are on the top left, you see that you have under 13 cardiac change in beats per minute, and you have an increase of blood pressure. So you have hypertension, as you can see here in red. And also inflammation, as I said, the vagus nerve targets the spleen. to have an anti-inflammatory pathway. So in the spleen, when you have inflammation, you have cytokine release, and this information goes to the brain. From the brain, this information comes back to the spleen to try to reduce inflammation through the vagus nerve. So if you have a non-functioning vagus nerve, then you will not be able to counteract this inflammation. You don't have this anti-inflammatory effect, and then the inflammation can go on storm. Okay, so this is why short-term breathing may have a lot of positive effects. I will show you here first the effects on two organs, heart, and we'll look at hypertension, and also spleen and inflammation. First, you have to remember that the positive effect of slow deep breathing depends on the procedure length, the effect of the positive effect. So if you do session of few minutes, 3 to 5 minutes, you will have positive effects, but after a few minutes, you don't have this positive effect anymore. You have a recovery. This is, for example, here in a study on blood pressure. You have this patient, you can see at baseline with a high blood pressure. And during the slow deep breathing, during 5 minutes, in the middle, you see that blood pressure is reduced. But a few minutes later, it comes back. It recovers. But if you do chronic sessions for approximately 20 minutes, for a few weeks, you have effects lasting few weeks or months. And that is when you definitely have symptoms. It's not only for just to have a good health. It's when you have symptoms to reduce. So for example, here in this patient with obstructive sleep apnea, you have an hypertension. You have here, you see the systolic blood pressure is around 140 millimeter of mercury. This is very, very high. And when you do this deep breathing, if you do that for a few weeks, continuously for a few weeks later, even without doing any practice of the slow deep breathing, you have a reduction of this hypertension in this patient. So that means that you have a very long-lasting effects without any lowering of medication. So it's not something that can be done just by itself. That is not enough. But if you can do that, then maybe you can lower the dose of your medication. So that's very interesting because, again, this slow deep breathing is just a matter of breathing. You don't need anything, any equipment, anything. You can do it every time, all the time, wherever you want. And so it's costless. It's good. And this is here, positive effect on inflammation. I showed you that the vagus nerve targets the spleen to have an anti-inflammatory effect. And when you have here an inflammation, this TNF is just a marker of inflammation, whatever. You'll see that is increased during baseline. It's high, not increase, it's high during baseline. After daily sessions of 15 minutes, in that case, in that study, for 1 month, you see a reduction of this cytokine release. So you reduce inflammation. And if you do that for 3 months, you have an even more pronounced reduction in inflammation. That's very important because inflammation is everywhere in all disease we get. Okay, so now it's time for us to do some body breathing. So it's that will be 3 minutes. So you will remember to do 5-second inspiration and 5-second expiration. Okay, so 5-second inspiration and 5-second expiration. You don't hold your breath between them. What does that mean? You don't do inspiration too fast. If you do, then you hold your breath and you have to wait 5 seconds, and then the next cycle you will be hyperventilating. Okay, So just breathe smoothly, 5 seconds inspiration, 5 second expiration. Remember to do it with the inspiration through the nose. I can explain later if you want to. And also increase your volume, your thoracic volume. So it's not only an abdominal breathing. What is important also is to increase thoracic volume, and I can explain later also why. Okay, we'll do now this deep breathing. So you will see this animation that I have created on the internet for some studies. If you type Caroline Sevoz-Couche animation, you will have different kind of animations. This is one of them. This is one in English. You have also in French. This is one with a blow. You can also have arrows. You have to be the more comfortable possible. And then you will hear a sound. With the beginning of the practice, you will see a sound to change between inspiration and expiration. So, okay, this was the sound. So if you want to close your eyes, you can, and just follow the sound. Inspiration, expiration. Inspiration, expiration. We are at the end of the first minute, 2 minutes to go. Remember to breathe smoothly. Don't force your inspiration. Don't force your expiration. Inspiration through the nose. Whatever you prefer for the expiration. Doesn't matter. Be comfortable. Be seated. And this is the end of the second minute. 1 more minute. We're nearly there. We are about to finish. You can open your eyes. That will be finished in a few seconds. Come back to us. And this is it. Okay, now you will have the possibility to get to this small poll here with either 2 possibilities. You can either click on this link that is on your screen, and remember that you have to put the code 672330, or you can also scan it on your phone. and you will get access to Slido. I think you can change to Slido. Okay, and then you can
maybe not everyone got time to put the code. Maybe go back. Je pense que pas tout le monde a eu le temps de mettre le code.
Okay, so more time to take this scan this code, QR code. It doesn't work. Okay. Okay, so now when you have clicked on this link, you have these 5 possibilities. You can click on several of them, okay? You please tell me what you feel, what you are feeling, sorry, after this very short slow deep breathing experience. Either you feel breathless, dizzy, or you feel nothing different from before, or you can also feel relaxed and or aware. What does that mean, aware? You are more aware of the environment. So for example, you are more aware of sound or perfume. So this is what was meant by a focus of attention. Actually, you can also feel the modification of heart rate when you do inspiration and expiration. You have an increase in the heart in beats per minute during inspiration, a decrease, and you can even feel it when you do that. So you can, again, click on different answers, then you send, and we'll get good. So you get these different answers. What are, do you think we have less every, so we'll wait a few more seconds for you to decide and to click on these possibilities. And then I will explain to you.
Put it in the chat.
It's 62. No, it's not 64. It's 62, 67, sorry. 23, 30. So a few more seconds to have to see the results and to have some kind of explanation. And that will bring me to now the positive effects, not only on the body that we have already seen, but on brain function. Okay, this is it. I think we can stop there. Okay, so everyone can see the results even at home.
I think so, yeah.
Okay, so as you can see, of course, thank you to increase on the screen. So as you can see here, the answer, the best answer for all of you, 73% of you is relaxed. So this is good. So that means that you have done the practice properly and you feel more relaxed. This is good that you also are more aware of the environment. This is something that is very important, because if you increase your attention and your focus, you will have a very good perception of the world around you, and you can even have modification in your concentration and so on. Some of you feel nothing, okay, and some of you are breathless and or dizzy. So this can be explained by, again, what I said in the beginning. The problem is with this practice, it's an easy practice, but you have to remember that if you do inspiration very fast or too much volume at the beginning, then the next one will be forced, and so on between cycles. And then finally, you have this hyperventilation. If you do hyperventilation, you have an increase in CO2 at the end, and then you don't feel well, and you have sore throat, and you feel breathless, and sometimes you even have difficulties and pain to breathe. Okay, so now I will explain to you why you feel relaxed and much more. Okay, so this is a very simple explanation. You don't have to remember, of course, of which part of the brain is involved or whatever. It's just to show you that there is a scientific reason behind that. Okay, you have respiratory neurons in the lower brain in the region called 1. These respiratory neurons, as we have seen, do modification of the parasympathetic vagal afferents to the heart, and you have this green oscillation of heart rate. Okay, but actually you don't have only that. You have also, because of the respiration, modification and oscillation of the blood pressure, following the same thing that the cardiac oscillation. So actually, when we say cardiac coherence, it's not only with the respiration, but also with the pressure, the arterial pressure. And when you have this big oscillation with the blood pressure, okay, so I don't push anything, and that changed by itself.
Okay, try again.
Okay, thank you. So when you have these oscillation, as you can see here in purple, so they last 5 seconds each, following the breathing, then you have stimulation of receptors on the vessel that are called baroreceptors because they are sensitive to pressure change. And when they are stimulated, there is stimulation of the vagus afferents to the brain. And from there, because of this stimulation, very regular, very long lasting compared to what is during spontaneous breathing, then you have strong inputs to the brain. And from the region number 2, you have projection to region number 3 and number 4. So first, this is very simple. Again, no need to remember whatever things. It's just to show you what you see in yellow, either in the side, front, or above the brain. It's a modification in activation. So this is more activated. And this is slow breathing compared to normal rate. So during the slow breathing, you have activation in all of these regions here in the brain. So again, it's not just a matter of just focusing on your respiration and then you feel relaxed. You have really modification in the brain functionality in different parts of the brain. So these different parts are 3 and 4. 3 is involved in different things like decision-making, motivation, emotion, pain processing, and interoception. Interoception is a term to say that you are aware of your body function or the environment. So you have during slow deep breathing activation in these different regions and more connections between them. Okay, and the region number 4 is involved in memory, learning, and gestion of stress. So this is hippocampus of amygdala, if you heard about that. So again, I will show you some positive effects. The effect duration of these positive effects depends on the procedure length. Few minutes, the effects will last few minutes. Here in pain processing, you have an example of pain when you put voluntary subjects, you put the hand in hot water. Then you have the pain threshold. This is the degree where you can feel pain. And you have the pain tolerance. This is the degree where you feel that it's very, very hot and it's too hot, you have to remove your hand, okay? And as you can see, compared to baseline, 6 breaths per minute will increase the pain thresholds. So that means that you will feel the pain a degree higher. And you will also increase the pain tolerance, so you can bear this hot temperature 1 degree higher. And this effect is better at 6 breaths per minute than 16 breaths per minute. And also distraction. Distraction here is neutral movie. It's just another proof that this effect on pain is not only because you are distracted by your focus on breath, because here the distraction has some small effect, but not as much as deep breathing. And for example, for your daily life, if you want to do a vaccination and your booster, then some of you are a bit afraid because of the pain with the needle. If you do deep breathing during a few minutes just before, you will feel no pain. Okay, this will not last long, but at least it works for a few minutes. The same for stress. Here in music, before and after, before music performance or before sport performance, you are on the baseline or you do deep breathing. And you can see that in both cases, you can decrease your stress scores. And again, this is interesting if you have vaccination or for your children, if they have examination to have, they can do few minutes of deep breathing and they will reduce their stress. You can also reduce impulsivity. For example, here, craving for food. You have selection of favorite dish, and then we present this dish, the favorite dish for you. So it depends on each of you. And then during that, you do deep breathing. And you can see that 10 minutes later, your hunger score, so your craving for this dish is lower if you do the deep breathing compared to if you don't do the deep breathing. So maybe it's interesting to remember when we have tea time, for example, or lunch or dinner. Okay, now a session of 30 minutes, the effects will last longer. I'll show you another positive effect, memory retention. So the task here is to do with your pen without holding your hands, you do this circle without touching the edges. You do that for different trials until something like 10 trials, and we score the motor errors. The motor errors is when you touch the edge. Okay, in blue, controls. You do that 10 trials. 30 minutes later, you do again. You see that you increase your motor errors. Not as much as the beginning, so you learn, but you don't learn much. And if you do the same thing 24 hours later, again, the motor errors are lower than the beginning, but still higher than what you get at the trials number 10. In green, you do the same, but at the retention at 30 minutes, you do the deep breathing. And you see that 24 hours later, you have a much lower motor errors than in the blue in the controls. And even better than that, if you do deep breathing at the end of the 10 trials, 30 minutes later, you still have a very low motor error score. 24 hours later, the same. So the only 30 minutes of deep breathing can really improve your memory retention, and that can be interesting for your children again for learning their homework, for example. Okay, now increasing sessions, the effect will last weeks or months. Here you can see that in these veterans, US veterans with a chronic pain, you see on the right part that you have a decrease in the pain rating in US veterans that did this daily session of 20 minutes of deep breathing during 4 weeks compared to the control. Doesn't work. Yeah. Then, okay, come back. Okay, here is to show that in this study, you have a baseline in blue, you have 10 days in red, or you have a follow-up of 6 months. The follow-up means that after the 10 days, you don't practice anymore, okay? And you have 3 conditions, either deep breathing or placebo, motivational video, or no intervention. And you see that it's only in the case of deep breathing that you have an increase in concentration, shooting, and a decrease in choice reaction time and movement time in these players, basketball players, and at 10 days, but also the effects last until 6 months after the trials. So they really are long lasting. And again, this is not something to see with any motivation or anything, because compared to motivational video, the effect is much better. The same for anxiety. You can reduce anxiety in this basketball player. And even the same in depression. In PTSD, post-traumatic stress disorder, you can reduce the depression score in black with people doing slow deep breathing than compared to only audio, CD audio for relaxation. And the same for the lack of control in people with a craving, food craving, but also drug craving or alcohol craving. You have a reduction of the lack of control with these patients. So now this presentation is almost finished. These are the message to take home. Only 1 breathing frequency is important, 6 breaths per minute. There is cardiac coherence with the synchronization of cardiac, respiratory, and pressure oscillation. We have then maximal stimulation of the descending vagus nerve, and then you have effects on multiple body functions, and you have maximal stimulation of the ascending vagus nerve, and then you have effects on different brain regions and multiple cerebral functions. So now if you want to do this cardiac coherence at home, remember 5-5-5, 5 minutes, 5-second inspiration, 5-second expiration, 2 to 3 times per day, that's enough. No need to buy any device or anything to see cardiac oscillation. No need, just 6 breaths per minute is enough. You can follow these on internet. It's very good, Vimeo or When You Breathe or mine. Maybe you don't have the link, but you just type my name and animation and you will see the link. And you have also application on Apple Watch, on iOS. Cardiac respiration relax is really good. Relax melodies, really good. And also application on Android. And one of them is Heart Rate Plus or Breath Plus. They are very good to follow your cardiac modifications during the deep breathing. So I thank you for your attention. I hope we'll get some questions. And at the end of this presentation, you can also have scan the QR code to have a short survey for this presentation. And remember to be coherent, to do deep breathing, and for relaxation, but much more. Thank you very much.
Any questions from the audience now? It's time for one question.
Yes, thank you. It was great.
Thank you.
Yeah, is there any explanation behind the fact that the daily respiration rate that we use is so different from the one that's supposed to be?
Well, the thing is, when you are stressed, of course, the breathing rate increases. So that means probably that nowadays we are a bit more too stressed compared to what we should do. And so our breathing rate is increased compared to what would be better for us. And so we have to work on the breathing rate, but we have also to work on trying to not to be too stressed and reject negative things. That would be better for everything. Okay.
Can I ask a question?
Sure.
Yeah, it's Isabelle. Bonjour, Caroline. You talk about the importance of thoracic expansion during the breathing. Can you explain why?
Thoracic.
You talk about the
thoracic. Yeah, sorry. Thoracic for different reasons, but the principal reason is that when you do the thoracic breathing, you actually stimulate what we call stretching receptors. Okay. Because of stretching of the thoracic cage. And when you stimulate these receptors, you have also projection on the brain and to reinforce either the blockade or the stimulation of the vagus nerve. So it's important to remember to increase your volume, so your thoracic cage. So not only the abdominal one, but this one. And also, of course, again, because you decrease your breathing rate, you have to increase the volume you get for inspiration and expiration smoothly, but you still have to increase the volume, and then you increase the volume of your thoracic cage.
Thank you, and thank you for your presentation. Very nice.
Thank you, Isabelle.
Okay, we have another question from the chat. It's a bit technical. So it says in the presentation title, there is a slow but also deep respiration, meaning that the respiration amplitude seems to be important. Is there some results on the modification of amplitude with the same frequency?
Sorry, say again, but louder.
Okay, maybe I'm closer to you. So the question goes.
Yeah.
In the presentation title, there is slow but also deep respiration, meaning that the respiratory amplitude seems to be important. Is there some results on the modification of amplitude with the same frequency?
Yeah, very, very good question. Actually, different studies have been done with a reduction of the breathing rate at 6 per minute without any modification of the volume. And you have this maximal oscillation. So it has nothing to do with the volume itself. But again, you have to increase the volume in the same time that you reduce your breathing rate to have what we call the same ventilation minute. Because then, if not, you will be get hyperventilating. So this is a deep, because you really have to increase your volume. But that will not, that has an effect, a small effect, but it's not the main effect of deep breathing.
There's another question in the chat from Satya asking if it's possible to combine walking or running with deep breathing, and if there's any evidence on this.
You can't really do that, because for slow deep breathing, then you have to reduce your breathing rate. Okay, if you are walking quietly, you can. If you are walking a bit fast or running, you can't. Because then you, of course, you have to increase your breathing rate. It's not just possible to do the slow deep breathing during an exercise. If you do that during some kind of yoga or Tai Chi or Qigong, then it's possible to do it, but not if you are doing some sport exercise or things like that.
Like something 20 years ago, I remember attending a session regarding breathing. At this time, they were saying that if you breathe with your tummy, it brings some benefits, because the tummy controls the several parts.
Absolutely. You have some benefits, but if you want to have the maximal benefits, then you need to remember to do also, you can do both, also the abdominal and also the diaphragmatic breathing to increase this volume in your thoracic cage. But yes, you have also positive effects with them.
Are we clear today on what are the different parameters between breathing with your lungs or with your thoracic? Of course, you breathe with your lungs, with your thoracic, or with your tummy. Is there any major difference between
the major difference is on the heart rate. If you breathe with your tummy, you don't have a good amplitude oscillation, and you still have some kind of variability. Really, the better to have a very regular heart rate variability, these large amplitude, but very regular one that are really needed to have this perfect coherence between oscillations, then it's better to do it with the lungs and the thoracic cage than the tummy. Yeah.
You were talking about benefit effects also on children, teenagers. Are there any studies besides according to the age? So it's going to, mix an age factor also. Is it the same for children, teenagers, and adults?
Yeah, it's the same. We have these positive effects in children or young adults. Children, the younger that I have seen, it's about 5 something, because they have to really understand that they have to follow these 5-5. So you can do with a very simple animation, with a kind of a sun, for example, with a 1, 2, 3, 4, 5 things. And but all the positive effects are the same in these in children or younger adults, with the maximal effects with the heart beats. The maximal difference would be around 20 to 30. So at 6 breaths per minute. So you have exactly the same. Now, 6 breaths per minute is for general population, but there are some slight differences that you can have depending on especially the height of people, because this has to do with some relationship between heart rate and blood pressure that I didn't explain here, just to be a bit more simple. And but in fact, if there is a loop, bioreflex loop that is called, and this loop determines the cardiac coherence, and that can be not exactly 6 per minute. When you do 6 per minute, this is 6 in 60 seconds, 1 per 10 seconds, and this is what we call 0.1 hertz. Okay, and actually cardiac coherence is between 0. Okay, I will come back. 1 cycle in 10 seconds, that means that is 0.1 in 1 second. 0.1 in 1 second is 0.1 hertz. And actually the cardiac coherence is between 0.09 and 0.11. So it's not exactly at 0.1, depending of the height. So that means that even if you are very young, but you are very tall, then maybe the cardiac coherence would be better if you breathe at 6.5 breaths per minute and not 6. But this is really hard to breathe by 6.5 breaths per minute. That means that you need to have 5.5 for inspiration, blah, blah. It's just too difficult. So just remember 6 per minute for anyone. You know that for some that can be slightly different, but that really doesn't matter so much. Yeah.
Earlier in the presentation, you were mentioning about reduction in inflammation and stuff like that. Even when you're doing it for like 6 months period, in normal periods.
Yeah.
Does that have? Is there any control for that? Like, if they were to keep doing those exercises for 6 months, or if they have any other change in lifestyle?
That's a very that's a very good remark. We can't really know what people would do at home. Sure. Okay, so what we can do is to control that they really do these 20 minutes, that they are compliant, because we have connecting device. And then we record and we know that they are doing it. But when the trial is over, we see them a few months later, and actually we don't know what they are doing. And maybe they do deep breathing, few minutes per day, every day. That is good. And then they keep these good effects going on and lasting. But I'm sure that they will not do 20 minutes because it's some kind of time to do that daily. But we hope that they do a few times per day later on. But we don't know. We just have to know what people say. So it's not easy.
It's only when they do the breathing, but if they do any other lifestyle changes with it, because they become a bit more aware of.
Yeah, maybe that can also help. Everything that can help. Again, this practice is not just the miracle thing that you do and that's it. No, you do that and you do sport and you reduce your calories in alimentation and you do a lot of things and that will be better. So if that can help the people to know that, yes, they have to be careful with their health and do a lot of things apart from deep breathing. So that's good.
We have some questions online.
Yeah.
I can take that one. So there's one that says, from an evolutionary perspective, as slow breathing seems to have only benefits, why didn't we do it naturally? Or why don't we do it naturally?
That's the same kind of question as before. It's probably because we are all a bit stressed and then the breathing rate is increased compared to what we should do. And even if you just remember during the day, maybe not to do 6 per minute because that's not easy to do. So you do the 6 per minute, few minutes per day. But on the other parts of the day, if you just remember to reduce your breathing rate, you still have some benefits. That will not be maximal, ideal, but you still get some benefits when you reduce your breathing rate. And again, it's probably linked to the stress situation.
I have another question. Is there a better time in the day at which you should do this?
No, but what you can do is try to find a routine. For example, myself, I do it when I do my makeup in the morning. So it takes a few minutes and then I do it every morning because I know that at that point of the day, I will do deep breathing. You can also do it if you want just before sleeping because that improves also sleep. The architecture of sleep is better and you reduce your time, your latency for sleeping. So you reduce insomnia. And so there are many more positive effects that I couldn't show here, but so this is maybe a good time for doing it at night, but it's not very good to do it while you are lying on the bed, because it is better to be sitting. And we have seen that you have maximal cardiac oscillation at that time when you are sitting and not when you are supine or lying on the bed.
Yeah, we have just a few more questions, if that's fine by you.
Yeah, sure.
There's one from Jérôme asking that if he understands the impact of the stop deep breathing on the body through the brain, but he was wondering what about the rate of oxygenation, the impact, he understood the impact from the brain, but he's wondering about the rate of oxygenation on the body.
Again, very good question. That practice will increase your oxygen in blood, your oxygen saturation. You all have heard about oxygen saturation because of COVID situation. Actually, when you do cardiac coherence, you remember you have coherence between respiration, so the beginning of inspiration and the maximal inspiration and the maximal heart rate. That means that when you are the maximal respiration here, then you have the maximal oxygen coming in the body, and then you have maximal heart rate. So with the heart rate, this is the oxygen in the blood will go everywhere very easily. And so you have a maximal oxygen saturation when you do the deep breathing compared to spontaneous breathing. So that's important. So that brings me to another point of the nasal breathing. When you do the nasal breathing, actually this is more one side than the other, but this is okay. Then you increase the resistance when you do that than when you do by the mouth. And when you increase the resistance here, you have more oxygen coming in your brain and then in the blood and everywhere. So that's good for that. And also, when you do the deep breathing through the nose, then you will have projection to the same regions that I showed before that were activated during the deep breathing. So that means that doing respiration through the nose will increase this functional connectivity, the improvement here in the brain, if you do that by the nose compared to if you do by the mouth. So this is better to do it by the nose.
I think that's it. We're going to wrap it up.
Yeah,
I think it's time.
Okay.
Thank you.
Thank you for your questions.
Thank you.
Thank you very much, Caroline, for the presentation. It was very interesting. Now we will all start to do the session of deep briefing every day. Yes, I learned a lot. Thank you very much. Thank you all for your participation in your question. Thank you all for people who are attending online. We hope to see you soon in our next AfterLab. Please feel free to respond to the survey as well. If you have any suggestion of topic also as well, please, we are welcome. Thank you, everyone, and have a good evening. See you. Thank you. Bye.